Hello. Welcome to a brand new medical surgical lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please have your notebook ready, your notes, and your textbook so you can follow along with this lesson. Thank you for joining me with this lesson. This lesson focuses on the RN nursing care of brain disorders, including headaches, seizures and epilepsy, brain infections, Parkinson's disease, Alzheimer's disease, and Huntington's disease. This is just a quick review and overview. By the end of this lesson, you should be able to understand that any alteration in the human body that involves the brain most often results in anxiety on the part of the patient and the family. You want to review the most common alterations in the CNS, including Parkinson's disease and Alzheimer's disease and seizure disorders, including the nursing care and the medical surgical interventions involved in interacting with these patients. You want to emphasize patient safety and the priority of assisting patients in meeting their own needs for day-to-day living within the parameters of their neurological disorder. You want to discuss headaches and their treatment and what the occurrence of the headache might indicate. You want to review infectious processes of the brain such as meningitis and encephalitis. Acute CNS infections and common chronic neurodegenerative diseases of the brain may impair a patient's ability, mobility, and cognition. The brain is part of the central nervous system that functions as body's center for controlling movement, for sensation, and cognition. Health problems involving disease or damage to the brain can be acute or chronic and often affect the patient's level of independence and the quality of life. Now let's do a quick overview of headaches here. First, we're going to talk about a migraine headache. It is a chronic episodic disorder with multiple subtypes classified as a long duration headache because it usually lasts more than 4 hours. It is characterized by intense pain in one side of the head and unilateral worsening of movement and occurs with either photophobia, which is a sensitive to light, or phonophobia, which is sensitive to noise. Migraines tend to be familiar and may have a genetic uh, basis or even a vascular, neurologic, chemical, or environmental things that are involved. Okay, they may do abortive therapy to alleviate the pain. Or drug therapy is usually prescribed for migraine. We may do some complementary therapies. You want to teach the patient about their drugs. Yeah, the patient may need to do some meditation, yoga, massage, exercise, biofeedback, being in a darkened room, ice, relaxation may help. And usually the drug classes that are used for migraines are going to be the triptans and the ergotamine preparations and the anti-epileptic drugs are going to be used. The patient with migraine triggers needs to avoid the triggers, and they should try to, that should help. Let's talk a little bit about cluster headaches. Pain is in and around one eye, usually, or one area, manifested by brief 30 minutes to 2 hours, intense unilateral pain that generally occurs in the spring or fall without any warning. They're classified as a common type of the short duration headache. Okay. Um, Teach patients about cluster headaches and precipitating factors. The next headache I want to talk about is tension headache. Pain is like a band squeezing the head. This is the most common type of chronic long duration headache lasting more than 4 hours caused by stress and tension. You want to teach patient stress reduction measures. Let's do a quick review of seizures. A seizure being an abnormal, sudden, excessive, uncontrolled electrical discharge of neurons resulting in an alteration of consciousness and impairing motor and sensory ability and behavior. Epilepsy is defined as two or more seizures experienced by a person. The International Classification of Epileptic Seizures recognizes three broad categories of seizure disorders: primary and or idiopathic epilepsy, secondary seizures, and coming from an underlying issue or primary idiopathic epilepsy. The broad categories that are recognized are generalized seizures, partial seizures, and some unclassified seizures. So you may see some other classification of seizures that are out there. Okay, the actions that should be taken during a seizure are what's important. Should be appropriate for the type of seizure that the patient is having. The patient may just be observed. The timing of the seizure should be done. The patient should be turned on the side to prevent aspiration and allow secretions to drain. You want to remove any objects that may injure the patient. Loosen any clothing if uh, for a patient that's having a tonic-clonic seizure or complete partial seizure, protect the patient from injury. Recognize that generalized seizures, such as a tonic-clonic seizure, involve both cerebral hemispheres. Partial seizures usually are focal seizures coming from one area of the brain. For patients who have had one or more seizures, place them on seizure precautions when you're in the hospital, which includes having oxygen and suctioning equipment and keeping the side rails up at all times and padded. Okay, and we want to make sure that we understand status epilepticus. Status epilepticus is a medical emergency characterized by prolonged seizures lasting more than 5 minutes or repeated seizures over the course of 30 minutes. The cause of status epilepticus may include withdrawal from anti-epileptic drugs, alcohol, and head trauma or infections in the brain, or there may be some cerebral edema happening in that brain, but there's usually some disturbances that are causing that. Patients who cannot be managed effectively with medications are candidates for surgery, so they may need to surgically fix them. But otherwise, the patient is going to be monitored using drug therapy. We want to make sure that the patient is instructed that the drugs can build up sensitivity as they age. So we want to make sure that we're monitoring the blood levels and we're adjusting the dose of anti-seizure medications. Meningitis is an inflammation of the meninges surrounding the brain and the spinal cord. Bacterial and viral organisms are most often the reason why this happens, but there are some people that will get a fungal meningitis or a meningitis from a protozoa. But bacterial and fungal are the most common. Viral meningitis is usually self limiting and the patient usually recovers completely. Bacterial meningitis is life threatening. We have issues with increased intracranial pressure, blockage of the CSF fluid, change in cerebral blood flow, and thrombus formation that are going to be a risk. Patients who are older than 60 years of age that are immunocompromised or signs of increased intracranial pressure usually have a CT scan performed before the lumbar puncture. For patients with meningitis, you want to carefully monitor their neurological status and you'll want to observe for signs of increased intracranial pressure. Okay. You want to encourage people that live in places that have a high density, such as college dorms or crowded areas, to go ahead and get the immunization against meningococcal meningitis. Encephalitis is an inflammation of the brain tissue, and often surrounding meninges are inflamed as well, affecting the cerebrum and the brainstem and the cerebellum. The viral agent elsewhere in the body most often cause the disease, even though bacteria, fungi, and other causes can happen. Viral encephalitis can be life-threatening or lead to persistent neurological problems such as learning disabilities, epilepsy, memory loss, fine motor deficits, and different things like that. In severe cases of encephalitis, the patient may exhibit increased intracranial pressure. You want to assess the patient's LOC. That should be a priority. You want to do lumbar puncture. They may do a lumbar puncture to diagnose, analyze the CSF. Supportive nursing care and prompt recognition of increased intracranial pressure is essential. You want to teach older adults, those with chronic illnesses such as influenza and pneumonia, such as with chronic infection, to get an influenza or pneumonia vaccine. You want to teach people who enjoy outdoor activities to avoid areas with mosquitoes and ticks, to in wooded areas, and you want to make sure that they're using mosquito repellent to minimize bites. We'll now conduct a quick overview of Parkinson's disease, also referred as paralysis agitans. It is a progressive neurodegenerative disease which often is idiopathic in origin. It is a very debilitating disease affecting the motor ability and characterized by four cardinal symptoms: tremors, rigidity, bradykinesia, or akinesia, and postural instability. The patients can also develop emotional irritability. They may be fearful and they may be a little bit insecure. Okay. Um, the cause may not be known, but it may be due to environmental or genetic exposures and exposure to pesticides, industrial chemicals, metals, and well water. And the diagnosis is usually made based on clinical findings other than uh, other disorders are ruled out. There's drug therapy, it decreases signs and symptoms of and allows the patient to have some a good quality of life. You want to monitor the patient for drug toxicity. Usually, Parkinson's disease patients are going to have levodopa combinations such as cinnamate, and you might want to make sure that the patient is monitored and uh, on those drugs. Surgery may be done if drugs are not effective. This includes a stereotactic pallidotomy or a thalamotomy. Okay, neurosurgical procedures such as deep brain stimulation are always being looked into in Parkinson's disease. Now let's do a quick overview on Alzheimer's disease, a chronic, progressive, and degenerative disease that's accounting for 60% of all dementias in older people greater than age 65. It is characterized by a loss of memory, judgment, visual spatial perception issues, and by a change in personality. Okay, the most important risk factors for Alzheimer's disease remain gender, being female, age, family history. Alzheimer's disease does show a genetic predisposition. Okay, the primary focus of the nurse neurological assessment is to identify any abnormalities in cognition, including language, personality, and behavior. And in these notes, I talk about the treatment plan for Alzheimer's disease, and it's going to be important that the patient understands the treatment that is prescribed for that. You want to make sure that you're collaborating with the healthcare team in the discharge planning. You want to remind caregivers of the patients that this is chronic and neurologic disease that can be stressful and psychologically demanding. You want to teach caregivers of patients with dementia to use validation therapy rather than reality reorientation. You want to acknowledge the patient's feelings and concerns. Let's review Huntington's disease, a disease affecting the brain's basal ganglia. It is a chronic hereditary illness that is transmitted as an autosomal dominant trait, um, usually transmitted at the time of conception. There's no known cure or treatment, therefore, genetic counseling is important. The first drug that's been approved to decrease chorea associated with Huntington disease, it's xenazine, and you want to collaborate with the healthcare team. You want to help patients and families identify community resources for these kinds of disorders, and you want to make sure that they're able to know what facilities are available for them. I showed this slide just a little while ago. It just shows the different areas that are affected by the disease. The diseases I've talked about. Alzheimer's disease tends to affect the cerebral cortex and hippocampus, and Huntington's disease affects the striatum in the uh, basal ganglia, and the Parkinson's disease affects the substantia nigra. Thank you for listening in to this lesson. I hope you have enjoyed this quick review of the RN Care for Brain Disorders. For questions about the lesson or the corresponding notes, feel free to email me. Have a lovely day.